In the old paradigm of health, if I was showing symptoms or I was sick, I went to go see a doctor. My doctor would prescribe a drug, and I would take that treatment. In today's world, with technology and be able to have access instantaneously anywhere in the world, the as a patient, I am self-diagnosing. I'm more aware. I'm taking care of my body. I'm self-monitoring in ways that allow me to treat and radically move things in different ways. Advent of wearables and the Internet of Things and the ability for patients now to be able to monitor their own heart rate, to be able to capture their own, a sense of wellness and capability that exists at the patient level, where they are self-diagnosing and have an opportunity to be able to connect with doctors and find information. How that's reshaping the future of health becomes really, really interesting, or becomes potentially exciting as we kind of think through what the future of health starts to look like, because the underlying business model that drug manufacturers have had for years, or device manufacturers, or even hospitals and doctors, has been fundamentally grounded on a premise that we are treating the sick. Now, in an environment of new capabilities, new technologies, emerging sorts of environments, it allows patients to be able to manage their own health, which means that companies need to start thinking about fostering wellness rather than treating sickness. And that paradigm, that shift, as we think about whether it be new technologies to edit within gene editing technologies such as CRISPR-Cas9, or being able for an Apple Watch now to be able to monitor my cardiac heart rate or my diabetic piece, means that companies are providing and developing services that are really allowing patients to avoid treatment and to move away from selling drugs to be able to foster those sorts of wellness.